Canada's Public Health Agency has purchased 500,000 doses of a human vaccine to protect against avian influenza. Let's discuss with Dr. Nicola Mercer, the Medical Officer of Health in Wellington, Dufferin, Guelph. Dr. Mercer, thanks for your time.
Oh, thank you for having me.
So the Public Health Agency has said that they've taken this step as a proactive measure. Before we get into this, I first want to kind of scale things back and talk about the spread of avian influenza, who's at risk, and general things that people should know about it.
Yeah, well, avian influenza was first really noticed and came to attention in 1997. We had a few outbreaks in other parts of the world. But since then, especially in the last couple of years, we've been seeing increasing outbreaks of avian influenza, first in bird flocks, so chickens, ducks, turkeys, and then more recently actually spreading to mammals. So we've seen it in dairy herds in the United States. And then as a result of that, we're now actually seeing a small number of human cases. So those who are most at risk right now are those who are in contact with either infected wild birds or who work on a daily and regular basis with poultry in particular. So that would be chickens, ducks, turkeys, or any other, if you have your own backyard poultry. So these are the people who are most at risk, and they're the ones that we are most concerned about. And so based on that, the Health Canada has said, you know what, we need to prepare, because it seems like it is growing in the number of human cases that we're seeing and the intensity. And it's a pretty serious virus if you get sick with it. So they've taken the precaution of purchasing this human vaccine. Right now, 60% is going to be distributed to the provinces and 40% kept in reserve. But we will find out who these vaccines are going to be distributed to. But my guess would be it will always be based on a risk approach. Who is most at risk for getting avian influenza, or bird flu as we like to call it? And those would be those who work in close contact on a regular basis with poultry.
Is this the first time that Canada has purchased and brought in a human vaccine for avian influenza?
Yeah, this is quite, it's quite interesting. Yeah, this is definitely the first time. And I think it really reflects the fact that we're seeing increasing numbers of outbreaks amongst, especially in commercial farms. We're seeing numbers of outbreaks. And now we're actually seeing transmission to dairy farms. And we actually have far more cases of this disease now in humans. So in Canada, we only have 2 cases documented, one in 2014 and one in 2024. So that may not seem like a lot. But when we look at what's happening in commercial operations south of the border, we can see that there is definitely a growing and increasing pattern of this virus going from an animal, either a bird or a dairy farm, to a human. So in thinking ahead and being very proactive, the government has decided that this is something that we should get ahead of and prepare those who are most at risk by having a vaccine available to them.
Okay. We have heard some reports health officials are watching the pandemic potential, let's say, of avian flu. Is this something you've heard of amongst health experts? Is it something that's on your radar right now?
What I tell people right now, be concerned that this is coming down the pipe. I don't think so. First of all, I want to say that this is more of a concern for our agriculture business, for our farmers and our farm workers in order to protect them. But this is something that has been around and in our environment for quite a number of years. And the biggest thing that we need to be concerned about is protecting them and protecting our food sources. In particular, if you have to cull a large number of chickens, then unfortunately we also don't have a lot of eggs, which is resulting in a higher price of eggs south of the border as well as in British Columbia, because we're short of egg-laying birds. So this is a big impact on agriculture, agri-food. At this moment, it's a watch and it's a control for everybody else in public health as we seek to protect our health workers, our agri-health workers, those who provide the food for us to eat.
Yeah, it's certainly very interesting. Of course, so important to talk about at this time as well. Appreciate you having the discussion with us, Dr. Mercer. Dr. Nicola Mercer is the Medical Officer of Health in Wellington, Dufferin, Guelph. Appreciate your insight. Thanks so much.
And thank you.